Neuroleptic malignant syndrome is a very rare, it is a life-threatening condition, and it's basically an idiosyncratic reactions to a lot of medications out there. So basically the patient present with fever, muscle rigidity, and an altered state of consciousness in such a condition which is known as neuroleptic malignant syndrome. So over here we'll be discussing this condition in detail, although it is very rare, but one should know how to diagnose these cases. One should know the differential diagnosis of this neuroleptic malignant syndrome as well, and you should know how to treat or how to manage such cases with this malignant feverish kind of a syndrome. So the medications that are causing neuroleptic malignant syndrome, they're again very important. One should have the knowledge to these medications, what prescriptive medications can lead to this kind of a syndrome. This is again very important. The signs and symptoms, that is basically the clinical presentation of neuromuscular, this neuroleptic malignant syndrome is again very important. The management, basically it starts off with the history taking, obviously, and then we'll move on to the investigations that are carried out in this particular individual. The treatment modalities that are offered to such an individual, it's again very important. That is basically the pharmacotherapies and how can you basically make the patient more stable and get him out of this emergency state. The neuroleptic malignant syndrome, what is the pathophysiology behind it is again very important. It is a very rare condition basically. In initial 4 to 11 days of treatment, it's basically evident. It's basically quite an acute condition right from the start. The patient, if he is prone to such a condition, to the development of such a condition, then he's going to exhibit the signs and symptoms in almost 4 to 11 days of the treatment. Hot weather is another risk factor to the development of neuroleptic malignant syndrome, and then we should know how to differentiate this syndrome from another clinical presentation which is quite similar in regarding the fact that it is again having the high fever and tachycardia. It's known as the serotonin syndrome, and it's related to the use of the serotonin reuptake inhibitors. So this is the basically pathophysiology behind it. Dealing with the medications that are causing the neuromuscular syndrome, the most notorious group of this is the antipsychotics. The antipsychotics are well known for the development of this NMS. The conventional antipsychotics, that is the phenothiazines and the butyrophenones, are most notorious for the development of the neuroleptic malignant syndrome. Then we have the atypical antipsychotics that include the risperidone, quetiapine, and olanzapine. Antiemetics such as phenothiazines and antiemetics, again, they are basically more notorious for the development of the neuroleptic malignant syndrome. The signs and symptoms that are involved in the neuroleptic malignant syndrome, they range from the muscle rigidity, and that is basically the extrapyramidal side effects, abbreviated as EPSE again over here, and hyperthermias, fluctuating consciousness. Then we have tachypnias, tachycardias, raised blood pressures, sweating is another sign and symptom, elevated white cell count. So this is basically how are we going to get to know. Basically we are also going to get the vitals of that particular individual. Then we are going to have the investigations including the CBTs, LFTs, urea creatinine, electrolyte imbalances are also going to be noted in such an individual, because we have to differentiate basically this state from any other differential diagnosis that can be included at that time. Then we can have the raised creatinine phosphokinase also observed in the preliminary investigations that are carried out, including the blood count. The management basically includes different stages depending upon the severity of the disease. Obviously, if it is a mild disease, it is going to be presented with mydriasis, shivering, sweating, tachycardia. So these are the clinical presentations of a milder form of neuroleptic malignant syndrome. Then we have a moderate kind of severity, which is basically characterized by an altered mental status, including the agitation, disorientation, excitement is going to be observed in these individuals. Then we can also observe autonomic hyperactivity, which is basically characterized by the rigidity, tachycardia, hyperthermia, that is basically temperatures that are more than 40 degrees centigrade. Neuromuscular abnormalities are observed, including the tremors, clonus, and hyperreflexia. So this is basically a group of clinical signs and symptoms that is going to indicate that the severity of the disease is of a moderate level. Then we can have a life-threatening neuroleptic malignant syndrome, which is characterized by delirium, hypertension, hypothermia, muscle rigidity is going to be observed, and tachycardia, that is basically an increased heart rate, is going to be observed in such individuals. The management stages would include the basically, first of all, the observational phase for at least 6 hours, and benzodiazepines are usually given in this observational state, and along with that, the admission to the hospitals is sometimes preferred, that basically because of the fact that cardiac monitoring is needed in such individuals, and along with that, cyproheptadine is given for this after the admission to the hospital and for the management of the cardiac symptoms. Intensive care units are sometimes more preferable if the condition is life-threatening. Esmolol or nitroprusside is given for the fluid imbalances. Then we have the Cooling-Myers, the sedation is given. Then we have the paralysis is observed, that is the skeletal muscle paralysis is observed in these individuals, and along with that, ventilation is also managed in these individuals. So basically, these stages depend upon the severity of the disease. If we have a patient of a milder form, just the observation is needed in these individuals. If we have a patient of a moderate form, then the hospitalization is preferred along with the cardiac monitoring. And if it is a patient of a life-threatening condition, then obviously ICUs are preferred, that is the intensive care units, and along with that, fluid imbalances, investigations are monitored. So it basically depends upon the severity of the disease in that particular patient that we are dealing on with. The treatment basically consists of the intermediate interventions, and along with that, we have to discontinue the antipsychotics. Antipsychotics, as I've already mentioned, they are most notorious for the development of this neuroleptic malignant syndrome. And again, the history taking is very important over here. One should know if the patient is taking any serotonin reuptake inhibitors, because basically we have to distinguish this NMS from the serotonin syndrome, which has almost the same presentation. We have to start on the anti-Parkinsonian drugs as well. The differentiation from the serotonin syndrome, as I've already emphasized, is very important. How do we do it? Basically, the onset, it's quite abrupt, and it can also be gradual in these individuals. And then in the neuroleptic malignant syndrome, it is more of the gradual type rather than of the abrupt type. The course is more rapidly resolving in the serotonin syndrome, and in the neuroleptic malignant syndrome, it is prolonged. The neuromuscular findings, if we have, it's basically in this serotonin syndrome, we have more of the tremors and the myoclonus. In the neuroleptic malignant syndrome, the patient is more of the rigid type. The skeletal muscles, basically, they grow into the rigidity in these individuals. Then when we have the reflexes observed, they are increased in the serotonin syndrome, while when we compare it with the neuromuscular, the neuroleptic malignant syndrome, it's basically decreased in these individuals. The pupils, when observed, mydriasis is observed in the serotonin syndrome, and in the neuroleptic malignant syndrome, the pupils are normal. So this is basically how do we basically, first of all, give a differential diagnosis, and then how are we going to differentiate this neuroleptic malignant syndrome from the serotonin syndrome in these individuals. So basically, in this section, we summarize the treatment modalities, the clinical features for a very rare condition, psychiatric emergency, which is known as the neuroleptic malignant syndrome. So that is the end to this section. Thank you for watching sqadia.com.